Bonadar, good morning, everybody. Welcome to day 3 of Value in Health Week, brought to you by the Welsh Value in Health Centre. Now, this morning's session is called The Landscape, a Welsh Government policy view on value-based healthcare in Wales. Just to let you know, all our events are recorded, so if you missed any of day 1 sessions or day 2 sessions, you can find them on our YouTube channel at the moment, and we'll have them up on our website later today, which is vbhc.nhs.wales, but I'll put a link for you in the chat shortly. If I can just quickly introduce myself, my name's Gareth Setter and I'm the Head of Comms and Engagement at the Welsh Value in Health Centre. And just before we get into today's session properly, just a few things I wanted to let you know about. We're halfway through the week now, Value in Health Week. So we've got this session this morning, and then this afternoon session is finance, value, and the world of costing. So that starts at 2 o'clock this afternoon. And tomorrow, both our morning and afternoon sessions, so the morning session, same time tomorrow, 10:30 to 11:30, and the afternoon one, 2 till 3, are called Value Voices, Making an Impact. So we've got 6 really exciting value-based healthcare projects from all across Wales, from the health boards to tell you about. So I'd really encourage you to join us for that. The timetable for the whole week and all the links which are open for you to join are available on our website. And again, I'll put the link into the chat. And lastly, just in case you haven't been on a Teams live event before, at the top of your screen you have the Q&A. So if you open that up, we'd encourage you really. We know it can be a bit strange, these events where your camera's turned off and your mic's turned off, but we really want to encourage you, and we have had so far amazing participation throughout the week. So please, any questions that you have, pop them in the question and answer section, and we'll do our best to get to them and answer them for you. Right, let's get into today's session properly. A Welsh Government policy view on value-based healthcare in Wales. So I'm really delighted to be able to introduce to you Shiran Menez, who is the Head of Value at Welsh Government. Thank you so much for joining us, Shiran. Good morning.
How are you, Gavin?
I'm really well, thank you, really well. Myself and Shiran are going to have a chat a bit later on, all things Welsh Government and value in a bit, so we'll catch up with Shiran properly shortly. But first, we asked the Minister, Eluned Morgan, MS, Minister for Health and Social Services, to give us her policy view on value, and diary commitments meant the Minister couldn't join us, but we were really, really pleased to receive a pre-recorded video, which we're really grateful for, because we know that takes time. So we're appreciative of it and appreciative of the contribution. So we're going to play that video out for you now so that you can hear Eluned Morgan's view. So let's hear from the Minister now.
Ryan, thank you for the invitation to say a few words as part of the Welsh Value in Health Week. I'm Eluned Morgan, Minister for Health and Social Services here in Wales. Now, we in the Welsh Government have made clear commitments in strategies such as Prudent Healthcare, A Healthier Wales, and the National Clinical Framework to be a learning health service that puts the emphasis on patient outcomes and value for the patient, their family, and society. Now, this is an ambitious and a really different way of thinking. It's not easy to ensure that business as usual gets done whilst also transforming the sector. But Wales has a really strong history of facing its health challenges and taking them really seriously. And Aaron Bevan showed this when he established the NHS 75 years ago. And as he said, we know what happens to people who stay in the middle of the road. They get run down. The Welsh Value in Health Centre was established in October 2021. And it's difficult to believe that it was only 2 years ago, as so much has been accomplished in that time by the centre to inspire us and create the foundations needed to build value in health within the sector and support the sector with clinical pathway redesign work. Dr. Sally Lewis is not only inspiring us in Wales and in other European countries with the opportunities that value-based health and care present. But I understand that she's also just returned from a tour of Australia, sharing the lessons that we've learned so far with them. In 2021, we also worked with Swansea University to establish the Value-Based Health and Care Intensive Learning Academy, along with 3 other intensive learning academies. It's provided intensive education courses for over 300 people from over 45 countries, and their 3rd cohort for the MSc are completing their first module at the moment. Now, the first cohort of MSc students have graduated, and many of them have made important changes in the sector as part of their studies, and many are going to use what they've learned to help transform the sector going into the future. Every health board in Wales has now established value teams who are working with colleagues on various clinical pathways and enabling them to stand back from their busy work to consider how the whole pathway could be designed differently. They're looking at the clinical pathway through the value lens in order to be more patient-centered and ensure the best outcomes for patients and enable intervention as early as possible in a patient's journey. All of this is underpinned by digital transformation and the development of intelligent data systems by DHCW and others. This includes enabling patients to undertake all kinds of tasks in an easier way. Appointment management may be where we begin, but it could lead to a much more interactive health system. We've started on this journey with the launching of the NHS Wales app this year. It also includes enabling the system to work more smoothly, and we have recently launched electronic prescriptions. Countries all around the world are realizing that they need to think differently about how their health service works, and Wales, we think, is leading the way. But why is the Welsh Government so committed to developing value-based health and care? Well, it's no longer acceptable just to measure finance and the number of patients, surgeries, etc., as if that's the end of the story. We need to plan for, finance, and measure what's really important: the outcome for patients, their families, and society. This is the way to ensure that we use our resources to create healthier individuals and populations. And how do we know what would be good outcomes for patients? Voltaire once said that doctors pour drugs of which they know little to cure diseases of which they know less into patients of whom they know nothing. Perhaps we've improved our understanding of drugs and diseases, but I think now it's time to get to know the patients. An important part of this is getting to know what our patients need and want through patient-reported outcome measurements, the PROMs, and also patient-reported experienced measurements, PREMs, and really listening to what's important to them. Congratulations to the Value in Health Centre recently for completing the procurement of the national infrastructure for collecting patient-reported outcome measurements. We're also getting to know our patients by taking part in the first ever OECD Paris population survey of patients over 45 within GP surgeries and finding out about their lives, their perception of the GP service, their lifestyles, their health literacy, and a broad range of other questions. Now, this is a comparative study with 19 other countries, and we will listen to the 10,000 people in Wales who've given their time to answer a lengthy questionnaire to tell us about their lives and the health service from their perspective. Collecting information about our patients is only one step. We're working towards having data systems that not only work well, but talk to each other. It's important that the relevant information about patients are presented to those who need it to provide medical advice, make medical decisions, or to plan and improve services and allocate resources in a value-based way. It needs to be presented in a timely, easy to understand format so that it can help ensure that good decisions and made at every level. Learning more about our patients will help us with the work of completely redesigning clinical pathways and putting more emphasis on prevention and early treatment. Higher value interventions occur earlier in the pathway and in timely diagnosis and optimization, ensuring that people don't become as ill as they otherwise would have. Value lets us find a way of investing in these kinds of activities whose benefits takes longer for us to see. Now, I think these are really interesting times. We hear so much about the challenges facing health and social care, and it's good to know that we are using the value lens to strategically and systematically transform the whole system so that it will improve health outcomes for people in Wales. Diolch am y gwahoddiad i siarad gyda chi heddiw. Gobeithio fydd y grŵp o siaradwyr eraill yn eich diddanu chi yn ystod y pnawn. Thanks again for the invitation to speak to you today. I'm really sorry I can't be with you in person. I hope that you're going to be inspired by the speakers you hear during the week. Diolch yn fawr iawn i chi gyd.
Diolch yn fawr, the Minister there for Health and Social Services, Elena Morgan. We really appreciate the time taken to do that. And we also asked the Chief Exec of NHS Wales and of course the Director General for Health and Social Services, Judith Paget, to take part. And again, we're absolutely delighted to receive a pre-recorded video from Judith as well, which we can watch now.
Shemai, I'm really pleased to be able to participate in this Welsh Value in Health Week. A Healthier Wales, our 10-year plan for a whole system approach to health and social care, was built on the philosophy of prudent healthcare, which was launched in 2014. Prudent healthcare described how we would reduce unnecessary and inappropriate tests, treatments and prescriptions, and ensure that people were able to make informed decisions about the care they received. It also stated that we would transform the outpatient model, making it easier to get specialist advice in primary care settings, and explained how we would develop strong public sector partnerships and integration to provide the right care in the right place at the right time. The National Clinical Framework and the Value in Health work undertaken throughout Wales builds on this vision and aims to deliver our ambition of a greater emphasis on preventing illness, on supporting people to manage their own health and well-being, and enabling people to live independently for as long as they can, supported by new technologies and by integrated health and social care services which are delivered closer to home. The concept of value-based health and care, developed in the USA, is revolutionary. Dr. Sally Lewis has adopted this model and adapted it to our social values, and ensured that Wales are leading the way internationally in doing so. I'm hugely proud of the enormous amount of work undertaken by the Welsh Value in Health Centre and value teams within health boards and other organisations in Wales. I'm also grateful for the important work undertaken by those working in close collaboration with them in the NHS Executive and in Digital Health and Care Wales, because using data and digital tools to enable us to do this work effectively is key. Transforming healthcare to improve patient outcomes by ensuring that services are value-based is developing and is reaping rewards. On a practical level, our budget of £22 million for transforming our health and care into a value-based one pays for national and regional value leaders and teams to redesign clinical pathways, develop PROMs and PREMs, improve data and digital systems, and provide education and training. But it pays for so much more than that. Value-based health and care is one of the mechanisms by which the health and social care sectors will be able to adhere to the Health and Social Care Quality and Engagement Act of 2020. It also pays for us to develop a different mindset and to reconsider how we do things in a deep and meaningful way. It's important that these thoughts are shared nationally so that we all learn from the various realizations and epiphanies that value conversations so often lead to. Value teams need to be in ongoing conversations with clinicians and quality innovation, digital finance, decarbonisation, as well as clinical audit teams, and as well as the value teams in other health boards. And I know this has been happening. The green agenda and the value-based agenda are aligned, and increasingly clinical redesign of pathways are being done with value for patients, society and the environment in mind at the same time. A value-based green clinical pathway will, for example, reduce patient journeys when face-to-face appointments are not required, or provide greener alternatives for inhalers and anaesthetic gases. We are currently working on stage 2 of establishing the NHS executive. Digital innovation and value will play a key role in it, embedding a new way of holding the system to account. For example, the development of 5 high-value pathways is to be tracked through the Value and Sustainability Board. I'm glad to be able to see that the work of transforming our health service into a value-based one is making a tangible difference. There is a broad range of activity happening across the sector, ranging from data-driven innovation in rare diseases such as cystic fibrosis to sustainable transformation of planned care in areas such as orthopedics. It includes early and secondary prevention work, such as the alcohol support team established by an Iron Bevan University Health Board, and the Swansea Bay University Health Board exercise and lifestyle programme for patients with a diagnosis of knee or hip osteoarthritis. Both of these projects are showing success on a range of value measures, but as an example, 80% of patients are reporting less analgesic for their osteoarthritis at the end of Swansea Bay's 16-week exercise and lifestyle programme. I'd like to congratulate another project from Swansea Bay who just won an NHS award. Their value redesign of heart failure, not accepting heart failure, won the Delivering Value Health and Care category. The work included establishing a heart failure hub in Gosainen Hospital and the Community Heart Failure Service, which includes an extremely successful rapid access diagnostic heart failure clinic. This clinic uses NT-proBNP blood tests as a gatekeeper and to triage urgency of assessment, and it's estimated that these blood tests have prevented 505 inappropriate referrals, 201 unnecessary outpatient appointments, and 408 unnecessary echocardiograms. Waiting times for the highest risk patients has therefore been reduced from more than 180 days to 19.4 days. I'm looking forward to seeing more success stories such as these in the future. Diolch yn fawr iawn. Thank you again for the invitation to speak to you today. I'd like to thank everyone working on developing value in healthcare for your work and your enthusiasm.
Diolch yn fawr. Thank you to Judith Paget there, Chief Executive of the NHS. Like I say, we genuinely really appreciate the time taken to record those videos for us. Now, I did actually introduce you to you at the start, but if you've just joined us now, I'm going to do it again. So delighted to have with us live Siwan Menes, who is Head of Value in Health for Welsh Government. Myself and Siwan are going to have a little chat now, but if you've got any questions at all, please feel free to pop them in the Q&A section at the top of your screen. Morning again, Siwan.
No.
Tell us a bit about what your role within Welsh Government for Value in Health entails.
Yeah, as Head of Value in Health, I'm responsible for the overall programme on behalf of the Welsh Government. So a lot of the work of the civil servant is about general strategy and policy making, and also supporting the minister, and also being responsible for funding the delivery of those strategies and policies in order to make sure that they work well and that the taxpayers' money is used well as well. I know that civil servants have a reputation for being a bit grey, but in my experience, it's the best career in the world. It really is exciting. It's a well-kept secret. So in my role, I work very closely with the Welsh Value in Health Centre and also with health boards and health trusts, and also the intensive learning academies, in order to make sure that all the programme works together well, and that we think strategically in terms of policy making for the future as well as making sure that the Minister plays her role in terms of leading all of this.
Great, thanks, Sharon. So civil servants' nights out are good fun then, are they?
Nap time's not as
The rumour
much.
has it.
Let's not go there.
Getting to know you, how did you get into this role within Value in Health? You know, what's your background?
Right, okay. Well, I've worked for the Welsh Government since a week after the National Assembly was established. So I've been there other than a few days since the beginning. But I'm a general civil servant, you could say. So I really enjoy moving from one policy area to the other. So I've worked in all kinds of policy areas, such as food policy, housing, Welsh language policy, adult education, corporate governance, and I was even diary secretary for a minister in my youth. But I've never worked on health policy before 17 months ago, as you said. But I always did hope that I would at one point do that. I was interested in care. I was a care assistant between school and university for a few months, and I've always said that that was the best job I ever had. And I went back to do to be a healthcare assistant on the bank for Bronglais Hospital on weekends a few years ago, just because I enjoyed it so much, and it's so different to be on the front line to what it is to be a civil servant. And so that's made me think a lot about what needs to happen in the health sector, as well as, you know, like everybody, I'm sure we've all got our health challenges now and again. And I know I had very little energy after having children, and I had to sort that out myself. And a value-based health and care service at that time would have been really useful for me. So all in all, when I was offered this post 17 months ago, I jumped on the chance, really, and when I started, I was even happier because I realised how exciting it was and how radical it is in terms of thinking differently and doing things differently.
And I suppose I didn't know that about doing healthcare, you know, being healthcare support worker. Yeah.
They wouldn't want me back, mind you, Gareth.
but really, I suppose doing something like that must be really helpful when you are involved in policy in this field. Yeah, interesting.
Definitely. I think a lot about my experience as a care assistant when I'm talking to people and when I'm thinking about policy, because I know exactly what the challenges are on the wards, for example. And so it's relatable. I'm not just talking in theory about the subject, I hope.
Yeah, no, completely. That's the point I was trying to make. You know, it gives you that perspective, doesn't it? If anybody's got any questions for Shuan, I can see a couple have come in. Then please feel free to use the Q&A bar at the top of your screen. So 17 months, Shuan, you said that's right, isn't it?
Yes.
Give me a few highlights in that time then so far in the Value in Health role.
Highlights so far. Well, I loved the beginning of the role because it was such a steep learning curve. It was so new to me, and I got quite obsessed reading about value-based health and care throughout the world, listening to YouTube videos, talking to different people. So I loved that. And also the main thing, of course, is getting to know interesting people who are doing amazing work, whether it be Dr. Sally Lewis and everyone in the Value in Health Centre, Hamish Lang in Swansea University in the Value-Based Health and Care Intensive Learning Academy, and more now talking to people within health boards and health trusts and realising that at every level there are interesting ideas and people doing amazing work, really. In terms of specific highlights, I really enjoyed accompanying the Minister to the what was it, the UK Kidney Week event in June or July, and seeing her doing a surprise Welsh language lesson for 2,000 kidney specialists from around the UK before talking to them about value in health in Wales, and that was good. Also, I really enjoy working with Sarah Puntoni on the OECD Paris Population Survey. I think that survey is going to be so useful for us, and it's so exciting to be working with 19 other countries on that. So I think that those are my main things I've enjoyed so far. Yeah.
Yeah, thanks, Sharon. And Sarah is actually one of our presenters in tomorrow's session. I think it's tomorrow afternoon, the Value Voices Making an Impact. And Sarah's talking there about the population survey, the OECD Paris, which has been an amazing piece of work, really. It's with over 30,000 patients responding to that survey. So huge data.
The Minister mentioned 10,000 people in her speech, and I gave her that figure, but the figure has been going up and up so fast. And of course, by now 30,000 people, including all those who have done partial returns or who aren't part of the our main GP surgeries that we're looking into. So that's amazing, because it was such a long survey for people to fill in. So Welsh patients have done really well there.
They really have, and we're all really excited about that as a team. Just going to be such because I think it becomes the biggest survey in that sort of GP primary care level ever in Wales, isn't it? Which is really exciting.
Well, and I think it's not just in Wales, it's true for all the other countries taking part as well. There's a gap in our data, and we're getting to grips with it, which is great.
Yeah, fantastic. Okay, so we've looked back at the last 17 months. So coming back to the present day, what's the main focus at the moment? What do we need to work on within Value in Health from a Welsh Government perspective?
Mm-hmm. Well, there's so much happening, so much good work happening all over the place, and such different projects. So for me, the focus for me now is I need to work with everyone, including you, Gareth. It's a challenge for you and me, in order to make sure that we've got a clear narrative, that we understand exactly what the benefits are of this programme and the funding of this programme, so that we can explain all together, right, this is the difference that this has made so far. I mean, it's early days. As the Minister said, it's only been 2 years since the Value in Health Centre was established, and it's amazing how far we've come in that time. And I think more and more now we can show the results of what we're doing. Although, of course, in the nature of the beast with value is that it'll make a difference long term. And that's, so we're not chasing quick results here, but just to be able to show, okay, this is where we are so far, and this is what we're hoping that will come from the projects that we're doing at the moment. So that's one of the main focuses at the moment. We've talked about OECD Paris already, and of course that survey, the OECD will publish its flagship report at the end of 2024. So we need to be ready for that. We need to prepare ourselves to really listen to what our patients are telling us, so that we're able to develop our strategies and policies and projects in terms of value projects to respond to whatever they say to us in that survey. And that survey covers all kinds of things like health literacy, lifestyle choices,
it's really
medication
detailed,
management. There's so many different aspects to it, and so we'll be able to compare what people think about different aspects and see what we need to prioritize. So there's a lot of work to be done in order for us all to be collaborating on that response at the end of 2024, going into 2025. Yeah.
That's going to be a big part of 2024, isn't it?
Yeah, it is. Yeah.
What's coming up? Okay, amazing, Sharon. That's fantastic. In a way, I suppose what you're saying about the communicating of the work that's going on across Wales. Please, like we said, feel free to pop any questions in the question and answer section. Adrian has dropped a message saying, I wonder whether the value-based healthcare website could have a clearer definition of what is value-based healthcare. I have feedback from colleagues that the website seems to assume people know what it is, and the definition is difficult to find. And Adrian, thank you for pointing out my fault. But no, I think that it's a really fair point. And you know, early next year, one of our focuses is going to be on our website as part of our strategy to really pull that together as a content hub, a rich information source, definitions. So I really take that on board. And to be honest with you, Adrian, I'll probably get in touch with you to get some more detail around that feedback.
And
Also,
I agree with Adrian there. Yeah, sorry, I agree with Adrian there. That's something that I'm seeing as well, is that people assume that value in health, value-based health and care, that they're the same as value for money, and so they don't go look any deeper into it because they assume that they kind of get it, and that's a problem that we really need to work on, so that it isn't the same. It isn't a variation on it. It really is something different, and it is about patient outcomes, and not about saving, just making savings.
Yeah, because there can be that thing, especially in the climate, isn't it? Is it, you know, cost? It's value cost cutting, which we know it isn't. But yeah, no, I totally agree. And John has dropped us a question as well. John Morgan says, jumping forward 5 years in time, when we have a health and care system that is embedded value-based healthcare much more, what does Sharon think would be some of the big changes we would see compared to now?
Oh, that's a good question, John, and I love it, but also I want a long time to think about it, really. In terms of the vision is that going back to what value is in a way, and going back to the formula, so that we're looking at, okay, suddenly patients will feel empowered. They will know what their role in the system is, that they're not passive recipients of health and care, but that they are part of the process, and that they have had a time and focus to think through, well, what is it they want from life? What is it they want from their health and from their healthcare providers? And to be able to express that clearly through their proms and prems, and to be able to know that the discussions between them and the health sector will be relevant to their lives, and not dependent on what the consultants' opinions are, etc. So I think that will be one of the main differences that we're aiming for. And in terms of resources is the other part of the equation, that our resources are spent well, and that we are able to, as Welsh Government, that we're able to see, okay, so we can prove that the resources that we've decided to spend on, that they are what's needed, and that they're making the difference, the real difference that we need, and that prevention will be just a major part of health and healthcare by then, so that we're not just firefighting, if you like, and taking care of the people who are most in need, but also taking care of those people who otherwise would be most in need in the future. Yeah.
No, I mean, yeah, it's really interesting, isn't it? Looking that far ahead with something like 5 years, like an interview question, a job interview question for you, Shuan. And also, I guess, 5 years time, won't it be absolutely fascinating to see where we are from a digital health perspective? What new things will have come in, how will it maybe experience health very differently from that digital view?
Definitely, and then that's what I mean by a part of the resources is
Yeah.
the digital infrastructure, because and that will make a huge difference. I'm working for the director of digital value and innovation, and so value and digital go hand in hand. They can't be done without each other, and digital innovation is something that we have to make sure that we sort out in health in Wales, because it's so crucial to all of this. We can't ensure that we get the patient outcomes right if we don't know what those outcomes are that they want, and if we can't monitor that information and make decisions based on the best information possible, so that we need to get our data processes right and make sure all our data systems are talking to each other, and that the people who need it have access to that information in an easy way, consultants, doctors, etc., that they have the data to hand when it's needed.
Yeah, no, very true. Thank you for that question, John. And I'm never going to miss the opportunity to do a quick plug. So talking of digital, yesterday we had a session yesterday afternoon all around the digital world, which was our Chief Digital Officer here at the Welsh Value in Health Centre, Dr. Saeed Shadi, being interviewed by our Deputy Director, Adele Cahill. So please, that's on YouTube. It'll be on our website later, so go and have a look at that as well. Okay, Sally, Dr. Sally Lewis has come in with a question for you, Shuan. So Shuan, bearing in mind your broad experience across the civil service, how do you see value being spread across other policy areas using the Wellbeing of Future Generations Act?
Yeah, that's a good question as well, Sally. And you know that I'm keen to do this. And what I'm seeing in this work is opportunities for all the other areas I've worked in throughout the Welsh Government. In terms of, for example, with the proms. But there's opportunities there to share what we've learned about how we do that in order to with colleagues, in order to see, well, how are we measuring outcomes in other areas of life in Wales, for example. And it's always important to be working with other directorates. For example, housing and health are closely linked. Food policy, where I've also worked, and health, they're also closely linked. So there's a lot of, as I said, it's early days for value and health, even in health, and working with social care is really important as well as a first step, I'd say, so that this isn't just about health, but it's also about social care. But also going forward, this is the conversation that we need to have as a society about how we want to have design thinking. If you think of value-based health and care as a kind of design thinking, and to be using that kind of mentality in order to look at what would work in all areas of life in Wales.
That's great. And are you really excited about those sort of possibilities, Shuan? Does that excite you when you look at what could be?
Yes, it is. I do enjoy those conversations, and that's one of the reasons why I enjoy this job so much, is because it's all about the future and transformation, and making big decisions about how to transform the sector in order to make things better for individuals in the future. We're not just talking about big decisions, of course, but it's to do with, you know, the right decisions being made at every level, but ensuring that design thinking, that which is value-based health and care nationally, so that all those small differences can be made at a local level as well.
Yeah. Okay, and Tessa Marshall's asked a question. Thank you, Tessa. Morning. Is the Value in Health team currently working with Public Health Wales to support the take-up of routine cancer screening? To be honest with you, Tessa, being totally honest with you, for mine and Shuan's roles, that's probably a difficult one for us to answer, to be that specific on that side. But I suppose the broader point there from Tessa is around strategic partnerships, working with all organisations, and that's very much what you see it as, Shuan, isn't it? That sort of collaboration sphere.
Yeah, that's really important. We can't work in silos on any of this. And as it happens, I've just been in a meeting where there was someone from Public Health Wales talking earlier today. So no, and you're right, Gareth, I can't answer the question about the take-up of routine cancer screening. That I wouldn't know about that. But at the same time, I know that the Welsh Value in Health Centre are working really closely with Public Health Wales, and I'm talking to my colleagues who are responsible for Public Health Wales within the Welsh Government as well. And it is an important link because, as we know, prevention is such a big part of value-based health and care. And so to make sure that, you know, value can make sure that the resources go towards that space. But in order to know what we do within that space, that's the role for Public Health Wales then. So that's how we collaborate in that space. And yeah, it's exciting times for prevention of all kinds, I think, because I think everybody now realizes that how important it is, and that it's been a weakness in the past that we haven't taken it seriously enough in the last few decades.
Yeah, fantastic. And Tessa's put a comment saying, apologies for being so specific. You've got nothing to apologise for at all, Tessa. It's really, really interesting, and it's given us that chance to talk about the work that we are doing with Public Health Wales around prevention. Okay, Shuan, I think that we have put you under the spotlight enough. So I really want to genuinely say thank you for doing that. But this for us, I know, you know, it's great to hear from someone in your position. I mean, I'm lucky enough I get to work with you, but it's great to hear from someone in your position in this sort of public field, talking about value in health, value-based healthcare, and talking so passionately about it as well from that Welsh Government point of view. So thank you so much for doing this morning. It's been really appreciated. And also I just wanted to say thank you again to the Minister, Leonard Morgan, and to Judith Paget, Chief Exec of the NHS, for those pre-recorded videos that they did for us. This has all been automatically recorded, this session, and it'll be on our YouTube channel, and it'll be on our website probably later today. So our next session is at 2 o'clock, where we delve into the world of finance value and the world of costing. So please join us then. Thank you ever so much. Thank you again, Shuan, and thank you to you all for your questions and for taking part. Thank you.
Thank you. Bye.